Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. In today's discussion, we'll be reviewing updates from the Centers for Medicare and Medicaid Services and the planned expiration of the COVID Public Health Emergency, also known as the PHE. Everyone has entered the meeting on mute, but we will have a discussion at the end of this webinar. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We encourage you to join us every Wednesday at 2 p.m. for more of our weekly webinars. Next week, we'll be having an open Q&A on all topics with our full panel of healthcare experts. And I will put in the chat in a moment a link to where you can submit questions in advance and where you can register for that webinar. So that will be next Wednesday at 2 p.m. My name is Kathy Caudell. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. Penny, thank you for joining us again.
Hi, Kathy. Thank you. And thank you everyone for being here today. We actually have quite a few updates to go over. It's kind of funny when we're planning these webinars ahead of time and we know there's this or that coming up. We think, oh, we can go over that fairly quickly. And then in a week, it's amazing what information we get in long-term care. Before I get into talking about the expiration of the public health emergency information, I did just want to mention we have been getting also this week a lot of NHSN emails. In fact, we just got one a little bit before this call. So those of you who input your NHSN data are also getting those emails. I do want to mention for the call next week, make sure that you do review those emails that you're getting. If any questions come up, that might be a good topic for questions that you submit to us for next week's Q&A session. And then I did want to mention too, NHSN CDC had that scheduled maintenance over the weekend, 2-4 and 2-5. I do believe that most of you probably do your NHSN data submitting during the week, but if anybody does weekend submission, I would just suggest that you just might want to check your reports and make sure that that maintenance didn't cause any glitches in your reports being submitted. So I'd suggest just going back in, taking a look and making sure that it looks like your NHSN data was saved and submitted correctly, just to avoid anybody getting into trouble. So moving on, the Biden administration did announce the end of the public health emergency, so those PHE waivers. And that is expected to happen May 21st, 2023. So everybody has a little bit of time to prepare for it. And really what the government is looking at right now is looking at moving from that pandemic to an endemic phase. And a long time ago, probably back May or June of 2022, Patty Austin, one of my coworkers, gave a nice presentation on the difference between pandemic, endemic, and all of those things. And really, when you're moving into an endemic phase, what CMS is really looking at, what the Biden administration is looking at right now, is considering that disease or condition, in this case, we're talking about COVID, to be something that's regularly found in a population or area. So really looking at COVID-19 as our new norm. And it's really important, though, as we go through these waivers, we talk about, it's the public health emergency is ending, that we still think that about these are viruses, and we know SARS-CoV-19 has a lot of variants, and we need to remember that viruses can still be dangerous and they can be deadly for high-risk people, and that's especially the nursing home population. So I think it's really important as we go over this information that we really do keep in mind what effect that can have on our population. So I'm going to pull up, and Kathy's going to drop into the link the CMS website where you can get to the first information that I'm going to share with you. And the first thing is right off the CMS website. It's loading. So can everybody see what's on my screen? Kathy, you can let me know.
Yes.
Should be the CMS long-term care.
Yes, we can see.
Okay. All right. The link that Kathy's going to put into chat for you is the link to the CMS website that gives you information on all the things that I'm talking about today, the waivers, the PHEs that are ending. And I would recommend that, you know, go to the website. This is like, this is an 18-page form. So really, I just, you know, pulled up a little. I actually did a Word document based off of this. And I would also like to say that I know anybody, if you're members of PHCA, they did a nice guide on pulling out the waivers that you need to know about right now for the May 21st date. But the reason I want to mention this is you know, in conversations that we've had before, discussions, I always encourage everybody to make sure that you're looking at the information that you're getting. It's very interesting to go back through this. As I was researching for today, what really hit me is going back through, and please close your eyes if this makes anybody dizzy. But there were a lot of those waivers in place, and quite a few of them, I think we may have forgot about some of them, but a lot of them terminated back in June of 2022. So it's interesting to go back to take a look at what was in place, and also think about some of those and read through some of those when you're thinking about what do I need to do to prepare for this next round of waivers to expire. So there are some things that we're going to talk about today. I pulled out the ones that you really need to prepare for May, and we'll talk about those. But I always think it's just really interesting to go through, look at the fact sheet from CMS, look at, you know, there's some links in there to other places where you can go, and it's just something very interesting. So I wanted to share that, and I want to make sure that people have an opportunity to take a look at that. So what I'm going to share next is this is what I pulled out of that. Oh, sorry. There I go again. Oh my goodness. Share the screen. Share it correctly. Okay. The Word document where I pulled out those PHE waivers that are actually ending in May, things that you need to think about. So the first thing that I know is very important when we're talking about nursing homes is that, and you can see my screen, correct? Yes, okay. The 3-day prior hospitalization. You know, that was one of those where the waiver provided the temporary emergency coverage of SNF services without that 3-day qualifying hospital stay that we were all familiar with prior to COVID. And that is one of those that is going to terminate. This waiver will terminate at in May 21st, 2023. So in preparation for that, you really want to make sure that, you know, you're going back to those policies and procedures that you had before with the 3-day hospital stay. I know, you know, with staffing, with staffing turnover, with staffing changes, bringing new people in, you really want to make sure that you're educating your staff, your people, if you have anyone doing your pre-admission, your HR people, that they're making sure that, you know, that residents who are coming in, that you've met the 3-day hospital stay. So it's those things that we did before, but it's just we need to start thinking about them again. And I am going to have time here at the end for questions. If anybody has questions, try to answer them to the best of our ability. So that's something, the 3-day stay, that's going to terminate. You want to be prepared for that. Then your PASAR, that pre-admission screening and annual resident review that was in place for those residents who come in with mental illness or intellectual disability. And they did allow those assessments to be suspended for 30 days, basically because of staffing and resources and that is going to end. So, you're going to want to make sure that those assessments are being completed as soon as resources become available. And again, it's educating those people who are in place, whether it's social workers or whoever is doing your PASSAR reviews for you. So that's another one that's ending that you have to be prepared for. Then this one, the alcohol-based hand rub dispensers. They had the requirement, of course, COVID dispensers, they were sort of out there, they were everywhere, and you were actually, they were saying, make sure they're there, make sure they're everywhere, make sure people can get to the hand-based, alcohol-based hand rub dispensers. But with the end of the waivers, we are starting to think again about, the way things operated before, and they do contain ethyl alcohol. It's a flammable liquid, so you really want to be looking at your life safety code. There's restrictions on storage, location of the containers, get your environmental services updated, educated on where things should be placed. And so these are things that you really need to start thinking about. A lot of people, with the dementia population that we have these days, really want to restrict access to prevent that accidental ingestion. So again, this is something, because for 2.5, 3 years, we've been pushing, make sure you have the dispensers where everybody can get them. And while we were trying to be safe, it's going to be very important that you talk to your staff and educate your staff on really being safe with these moving forward. Now, a couple other things to mention, the required facility reporting. This was, so our NHSN reporting that we're doing for COVID. While the public health emergency is considered to be we're moving from a pandemic to an endemic, this mandatory COVID reporting is going to be extended beyond May. So this is beyond the current waivers and is going to be in effect at this point until December 31st, 2024, unless we hear something different in the meantime. So that is one of those things that is going to continue. So your reporting will continue. So you need to be aware of that. And again, the testing requirements, that is also, the reporting on that is going to continue through December 31st, 2024. So those were two things that were in that CMS fact sheet that I wanted to especially point out, that those are a few things that are going to continue reporting requirements beyond everything. So with that sort of goes over the public health emergency requirements. I do want to talk a little bit about the temporary nurse aid program, because that was something that was one of those things that ended. Now, I know that we're still having some issues in the state with the temporary nurse aides getting in there, getting their certification. And the issue really seems to be having enough proctors to be able to be at those sites to help them get the certification. My understanding is that they're still backed up in a lot of areas across the state. I know I got an email from the State Board of Nursing asking me if I would like to be a proctor at one of their sites. So some of other licensed nurses may have received that also. So with the temporary nurse aid, that is absolutely, that's still April. And so you really want to make sure that you're working on getting those temporary nurse aides that you want to keep, that you're working on helping them get their certification, making sure that all the documentation is there, all those things that we had talked about before. I'm gonna go real quickly to QSO memo. I forget the number. I'll have to pull it up here and see. I'll pull it up and we'll all be able to see what the number is. It has to do with the, let me see, which one is that? Oh, here, this is this one, sorry. Does anybody have, I probably should, do you have any questions about what I've talked about so far? I'll give everybody just a minute before I pull up that's the QSO memo has to do with the schizophrenic diagnosis audits that are being done. So if anybody does have a burning question about the PHE information that I just went over and you'd like to submit that question right now, we can go over that, or I can, if I don't see anything in a minute here and chat or Q&A, I'll just go on to that QSO memo.
If anyone wants to submit questions, you can use either the chat, the Q&A, or if you'd like to ask your question out loud, you can use the raise your hand tool and we will enable you to unmute yourself to ask your question.
I don't think I see anything at this point.
No, and we can
No,
see the screen now for the QSO.
Okay, so that should be there on the screen now. And this is again the QS 2305 and a nursing home. Oh, amazing. I just can't remember all these QSO numbers. But anyway, this one I really wanted to talk to everybody about because it's very important. CMS is going to be conducting audits of schizophrenia coding in the MDS data set. And they will be adjusting nursing home compare quality measure star ratings for those facilities who have audits that reveal inaccurate coding. So I think, you know, in the memo, and Kathy has that posted in chat, so you can pull the menu ready for lunch memo and have it in front of you. But we know that, you know, the star rating calculation, long stay residents receiving antipsychotic drugs, and of course the exclusions, which were right here, were those diagnoses of schizophrenia, Huntington's disease, Tourette syndrome. And there were some cases that I know that we're all aware of. There were times when someone had an antipsychotic medication and then they had a diagnosis of schizophrenia added to their diagnosis list. And there's a lot of concern. There's a lot of concern with, and looking at COVID. COVID has a lot to do with it. You know, we've had intense scrutiny in nursing homes over the last couple of years. I can tell you right now, unfortunately, I think this intense scrutiny is going to continue. In some cases, it's good. There are some bad nursing homes out there that need intense scrutiny. Do all of us need it at this point in time? Probably not. But there's a reasoning behind it that, you know, while we were going through COVID, there was a lot of isolation. There were residents who could have been put on antipsychotic medications because there was a lot of anxiety. And we know that there were a lot of issues. And now so that increased scrutiny happened and they started to question, are there really that many residents who have these diagnoses, who are on these antipsychotic medications? I don't think Pennsylvania, the last data that I got for Pennsylvania showed that we were maintaining our lower, and we had worked with a lot of nursing homes for a lot of years in decreasing those antipsychotic medications. We made a great progress in the state, also in West Virginia, both states, West Virginia and Pennsylvania, to really lower that antipsychotic medication use. And throughout the pandemic, the last numbers that I saw from early, like middle of last year, were that Pennsylvania and West Virginia had sort of maintained those lower antipsychotic medication rates. But of course, CMS looks nationally. when they have to evaluate how things are happening. So they really believe that there could be some residents who were erroneously coded as having schizophrenia, and that they were given the antipsychotic medication for other reasons. And so they are going to be doing audits of the coding, and it will adjust quality measure star ratings. And so you really do. So this would be a good time to go back, pull up your quality measure CASPER report, look at those residents who are coding as being on antipsychotic meds, pull up your resident level report, see which residents are on those antipsychotics, and have your team. And this is one of those quality improvement processes that we've talked about with nursing homes that we worked with before, is you want to make sure that you have your team go in and look at those residents on antipsychotic medications and look at their diagnosis and truly do a root cause analysis for why they are on that antipsychotic medication. Now, the root cause analysis of why are they on this medication? Do they truly need this medication? Do they truly have this diagnosis of schizophrenia? Or making sure that you're not just trying to justify why they're on the antipsychotic medication, because that's probably my belief is what the audit's really going to be looking at. And so have your team look at and start it, then that's moving back into getting back into doing the behavior management, working with your farm consultant. And you know, I know all these things that I'm talking about in this day and age with staffing the way that it is, everything is a challenge, but it's how we need to operate for nursing homes to do the things that they're expected to do and do them the right ways. And we can help you with those quality improvement projects, but that behavior management team, get that team back together, look at those residents who are on antipsychotics. If you're not sure if their diagnosis really justifies them being on it, work with your team, work with your farm consultant, work on how can we move that person off of the antipsychotic, where you need to look at their behaviors, you need to document their behaviors, you need to educate your staff on what are alternatives to that antipsychotic. So all those things that you really need to start thinking about, start working on now, because they take time to get them in place, and it takes time to get residents off of antipsychotics, and it takes time to monitor their behavior and find the right interventions for them. So you really want to make sure that you're starting to think about this and look at this and start doing this now, so that you can start to eliminate or show that you're starting to eliminate. Don't forget to have that documentation, so that when CMS is starting to conduct those offsite audits, you'll be able to show that you really are, that it is accurate coding, you've looked at it, or if they are on an antipsychotic and you feel that they need to come off of it, that you're working on doing that. So it's just one of those things that's coming out that I just wanted to make everybody aware of. Download the memo, take a look at it, read through it. There are some other things on here that's good information, but really start to think about, you know, what do we have to do to make sure that we aren't audited, we aren't found to have an accurate coding, and that will affect our star rating. So that is everything. I know that's a lot. Would I be willing to share my Word document? Yeah, I would. If you have PHCA, they have a Word document exactly like it. That's much nicer. But you know, if you're not a member, I have to, of course, I have to ask Kathy, my communications person, if she can fix it up and make it look a little better. And then yes, I can share that. It's really just, like I said, pulled out. Yeah, we did actually put the PHCA Word document in the last minute lowdown. So
Yeah, it was in last week's. So I always email everyone following the webinar with the recording and any other resources. So I can definitely include links to all of that and maybe an attachment to your Word document, or we can create a version of the PDF with highlighting the parts that you took out.
Yeah, and like I said too, please make sure that you go to the CMS website and you pull off their document and go back through, and it's always a good lesson. One of the things is, you know, as we are moving back into this endemic stage, really going back through and looking at all those things last year, because we were still in the middle of everything last year in the nursing homes, you know, still some COVID outbreaks, really working on the vaccinations. Again, staffing plays a big factor in everything. We especially realized that. So you really want to go back and look at some of those things that happened, and that the waivers that went away, and make sure that you address them, that you have them in your policies and procedures, that you're familiar with them also. So looking back over what was already terminated and how you're practicing, and then also looking forward to those things that are coming up to end and how you can prepare. And I see Michelle, that's excellent. Michelle, you did find an erroneous diagnosis, and that's great. And that's the kind of thing that you really have to do. It does take time. It takes time for those dose reductions too, if you do find that someone is on an antipsychotic. So that's why I say, really, you want to get started now on doing all that. Any other questions or comments? And if you, after this, I know it was a lot of information, and you can go back and look at the fact sheet, the QSO memo. And as I said, you know, Kathy said earlier, we're having the question and answer session next week. And so if you come up with any questions that you think of for some of this information, and you want to send us some comments, some feedback, and then we can answer some questions that you might think of later on. Anybody else? Questions?
While we wait for the last couple of questions, and again, if anybody wants to ask their question out loud, you can raise your hand. Sometimes it's a little faster than typing it out. I put into the chat links for registering for next week's Q&A webinar, which again, it's on all topics. It can be about what we talked about today, but just anything that anybody wants to talk about. We have a form where you can submit the question in advance, and then I have the link where you can register for that discussion. And then I also wanted to, and again, that was 2 p.m., same time, same place next week. It's 2 p.m. Wednesday. And then I also wanted to remind everyone about our weekly virtual live chats. Actually, it's bi-weekly virtual live chats. For those of you who've come to a lot of our webinars, Deborah Wright is usually the quality improvement specialist who will be on those calls. We are starting to use Zoom now. They're every Tuesday and Thursday at noon. We include the link to those live chats in the Last Minute Lowdown newsletter that Penny was talking about earlier. And so you can talk about any topics that you're interested in, such as quality improvement initiatives, infection control, or NDS coding. Just show up and hit us with your questions. And for anyone who's not on our Last Minute Lowdown mailing list, you can email me at ccaudell@qualityinsights.org if you'd like to be on that mailing list. And we include links to all of our webinars and live chats really close to the top of that newsletter. And I'll put my email in the chat shortly for anyone who needs it.
You can throw mine in there too. And I'd also like to say, I see we're coming close to the end of, yeah, we'll put our emails in, and please feel free to reach out individually. And if I'm not the person working with you, I'll get you to the right person also. And trying to keep this, you know, within the time frame. We really appreciate your attendance. We really want to continue to give you the information that you value. We have a lot of exciting webinars coming up with we're going to be talking about sepsis and just a lot of different good Wednesday webinars. And so we appreciate your attendance, and we hope to see you in the future. And as always, please feel free to reach out to us as needed. We are here.
Yeah. And I think we actually have slightly higher attendance today, and there might be people here today who have not worked with us. So if anybody wants to know who their regional quality improvement specialist is. If you have not been in touch with any of our quality improvement specialists, please reach out to me or Penny, and we'll put you in touch with your region's QIS for West Virginia or Pennsylvania. We have five quality improvement specialists for each region.
No, not 5 for each region.
Five,
We have
sorry,
5 and they cover
five
all
for
the
5 regions.
Oh, if we only had that kind of staffing. I'm sure the nursing homes would like
Yeah.
5 people for every resident.
That's true. Thank you, Penny.
Oh, and thank you all for your comments and for attending also. We really appreciate that.
Yeah, and I think we can wrap up here. If again, if you want to contact me, my email is caudill@qualityinsights.org. Penny's email is pimes@qualityinsights.org. It's PIMES. And I think we can wrap up here. I don't see any more questions in the chat or the Q&A. Thank you all so much for coming today, and we hope to see you all back next week.
Bye.
Bye.